Have you ever wondered how NHS dental charges actually work? Why is it that a patient can sometimes pay 5 or 10 times less for an NHS treatment compared to a private treatment? Surely that means the NHS is amazing. Why is everyone complaining about it? In today's video, we're pulling back the curtain on the NHS banding system, particularly Band 2, and comparing these charges to the cost of a similar treatment in a private clinic. This video is going to show you how dentist incomes are affected and also how patient care can be impacted. Hi guys, if you're new here, my name is Komor and I'm a dentist based in the UK. In today's video, we're talking all about Band 2 charges, what they mean, what they cover, and why more and more dentists are trying to move into private dentistry. Now, if you haven't seen my first video about Band 1 charges, you're going to want to watch that first because we looked at NHS Band 1, which is the examination. It was quite easy to understand. But this video is going to get a little bit more complex because what happens when a patient needs treatment on the NHS, like fillings, root canal, extractions? Well, that's where Band 2 comes in. Let's imagine the Band 1 part is done. Dentist has already conducted an examination and found that several teeth need treatment, specifically multiple fillings, extractions, and a root canal was needed. In addition, the dentist has found that the patient needs periodontal therapy. This brings the patient and dentist into the realm of Band 2. So what exactly does a Band 2 charge include? Well, under the current NHS system, a Band 2 charge is £73.50. This amount covers all of the Band 1 charges, so that's your examination, x-rays, oral hygiene and diet advice, smoking cessation advice, scale and polish, and the Band 2 also covers the rest of the treatment that is needed. If it's fillings, extractions, root canal, periodontal therapy, anything that is direct treatment is covered in the Band 2. This system doesn't take into account how long these procedures need, how much skill is required to complete these procedures, what materials will be required to complete these procedures. The practice and the dentist just receive their fixed payment. So let's talk about finances. Think of the NHS banding as a prescription charge. A patient will only pay £73.50 for their treatment because the treatment is subsidised by the NHS, not because that is what it's worth. Just like a patient may pay £9 for their NHS prescription for medication that is worth thousands of pounds because it is subsidised by the NHS. And remember, the Band 2 charge that the patient pays doesn't go directly into the dentist's pocket, it goes to the practice, which compensates the dentist based on their UDA rate. Under the NHS Band 2, a dentist will receive 3, 5 or 7 UDAs. I will put a chart over here that explains how all of that works. The 5 and the 7 UDAs have actually been introduced quite recently. Up until then, it was just 3 UDAs for any treatment that you do. Doesn't matter the quantity, doesn't matter what type of treatment it is. If it's a direct treatment, doesn't matter if it's 1 or 10, it was 3 UDAs. But let's use the scenario of the dentist that's getting paid £10 per UDA for 3 or more fillings or extractions, or for a root canal on a premolar, not counting how many premolars. You could be doing 3 root canals on 3 premolars. The dentist would get 5 UDAs, which equates to £50, regardless of, again, what materials were used in the procedure, how much time was taken to do the procedures. Then a molar root canal, doesn't matter how many you're doing, you could be doing 1, you could be doing 4, would give the dentist 7 UDAs, which equates to £70. Again, the 7 UDAs covers every other procedure that would have been done. If that's 2 fillings, 1 premolar root canal, 1 molar root canal, a periodontal therapy, that would all come into the same umbrella term. I hope that makes sense. I know it's long-winded. It took me time to get my head around it when I first started, and it just doesn't make sense, does it? But let's break it down even further. To meet their targets, dentists need to achieve thousands of UDAs per year. If we say an average of, let's say 30 UDAs should be completed per day, which is actually quite high, let's say 10 fillings in a day to earn the £300. Now contrast this with the private financial model. In private practice, patients pay directly for the services that they receive. No UDAs, no government subsidies, no targets. Dentists are just paid for their time, materials they use, their expertise, etc. So in private practice, dentists will charge a fair price for the procedure. For example, fillings are priced completely different to root canals, which are priced completely different to extractions, because they all require different types of skills and different types of materials and different amounts of time. The dentist usually receives 40 to 50% of the total cost of treatment, and the practice receives the rest to be able to run the practice and pay their staff, etc. For a dentist to earn £300 privately, it could take a few hours, compared to a whole day for an NHS dentist who has probably been running around, hasn't had a break, hasn't had much time to actually speak to their patients, and is just super stressed out, burnt out, and not loving it. Fillings typically cost £100 to £200. If a dentist completes 10 fillings on a patient and the patient pays £100 for each filling, they will be paying £1,000 in total, and the dentist will earn up to £500 for the treatment that they've completed. Versus 10 fillings on an NHS patient, the patient pays £73.50 and the dentist earns £50. That's literally 10 times less earnings. Or another example is extractions cost around £150 to £300. If a dentist completes 5 extractions for £200 each, the patient will pay £1,000 and the dentist will get paid up to £500 of the patient charge, versus 5 extractions on an NHS patient, again where the patient pays £73.50 and the dentist will earn £50, again 10 times less. These might seem like exaggerated numbers, but this stuff happens in real life. That's one reason why NHS practices are not taking on new patients, because a new patient likely hasn't seen a dentist in years and is likely to require much more treatment, and therefore the practice and the dentist will make a loss by seeing these new patients. And as of recently, the NHS is actually paying practices more to see new patients as an incentive, but they're still not addressing the root of the problem. For dental practices, it's easier to stick with patients that they know, patients that are stable, or patients that need the least amount of treatment, because that will be more profitable. But can you see how soul destroying that is for a dentist, especially a dentist that cares about their patients and went into dentistry to help people? So you might still be wondering, why are NHS dentists leaving the system and going into private practice when all these patients need NHS dentists? It's simple. The financial strain of the NHS system is overwhelming. To make the UDA system work and to make it profitable for the business and for the dentists are required to complete high volumes of treatment in a short amount of time. The system is underpaying practices and dentists, and I think people have just had enough. Let's talk about what this means for patients. For patients, it can have mixed consequences. If a patient wants to use NHS care, they're going to face longer waiting times and they're going to face a restriction on the treatments they can have. However, in private care, patients are likely to be seen quicker, have a more personalised service, and access to a wider variety of treatment options. While private care is more expensive, it does provide flexibility and quality. But for many people, cost is a barrier. The UK is in a cost of living crisis. I totally get that. Not everyone can afford private treatment, which leaves the NHS as the only viable option. However, for many patients that may be able to afford private treatment, they end up comparing the NHS prices as a baseline for what's a fair price for treatment. So when you tell them, Mr. Patient, you need 10 fillings and it's going to cost you £1,000, they will see red flags because they heard that 10 fillings on the NHS is £73.50. I think NHS dentistry has created an issue where patients don't see the value of dentistry because they're paying so little for it, and they don't see the value of paying for private dentistry. So what does all this mean? Why am I saying all this stuff? Because in private practice, dentists can earn a fair wage, they can see a lower volume of patients, they can take time with their patients, and they can provide better care. I don't care what the NHS lovers have to say, this is a fact of life. Anyway, that's it for Band 2 charges. If you found this video informative, please let me know your thoughts in the comments below. Do you think the NHS dental system needs reforming? And if so, what reforms? As always, thank you for watching, and don't forget to look out for the next videos where I'm going to be talking about Band 3 and 4 charges and the world of NHS dentistry, the world of private dentistry, the world of facial aesthetics, and the world of self-growth and valuing yourself. Thank you for watching. I'll see you in the next one.